A new professional pathway is emerging in the dental field with the goal of addressing North Carolina's shortage of dentists and thus limited access to primary and restorative dental care services. Now, this afflicts particularly areas of our state that are more rural, as well as some of our more vulnerable populations. Jordan Roberts is the healthcare policy analyst for the John Locke Foundation. He has just released an analysis that he co-wrote on the subject of dental therapy and dental therapists in North Carolina. Jordan joins us now. Welcome back to the program.
Thank you. Glad to be here.
Okay, so tell us first about this dental care shortage in our state.
Well, as many of the listeners may know, we have a very rural population, one of the biggest in the country, and in these rural parts of the state, there tends to be a real lack of health professionals, and that includes primary care providers, mental health professionals, and especially dental professionals. And so data shows that out of North Carolina's 100 counties, 74 of those counties don't have an adequate number of dental professionals to serve the nearby population. So folks in these places, the more rural parts of the country or state, really have a tough time accessing care.
Which is why there is an effort underway, and you are one of the researchers and analysts that's been looking at this. So what can we do? What are the options for trying to make sure that people do have access to this type of care? And the field that has emerged is in a couple of other states is called dental therapy, and the people who engage in this are called dental therapists. So tell us what that means.
So despite what the name means, there's no psychologists or psychiatrists involved in dental therapy. So these are mid-level dental practitioners. They're highly educated and highly trained professionals. Think of a nurse practitioner or a physician's assistant, so they can't quite do all the things that the dentist can do, but they have a wide scope and more than a dental hygienist. And they, in other states that they've been allowed to practice in, the benefits have been great. They tend to serve underserved populations because when the regulations around the profession are very flexible, they can have what's called a general supervision contract with the dentist, which allows them to travel outside of the dentist's office and serve the populations that they want to.
So these are educated folks. They're not just people who want to try to help people in general. I mean, they have specific skills, not the skills to the level of a full dentist, but they know how to do certain things. Like what?
Well, they specialize in preventative and restorative care, taking care of your teeth, and they can do some other things like fillings and,
a lot of things that people routinely need to have
Absolutely.
done, but which doesn't necessarily require the time of someone who is certified as a full dentist.
Right, and so when dentists can have these professionals in their practices, they can utilize them at a higher rate to offer these preventive and restorative procedures, and then dentists can focus more on the highly complex procedures. So there's benefits throughout the whole spectrum of the dentist practice.
So, Jordan, why is it then that in North Carolina we have not seen this field and these specialists?
Well, just like with a lot of other public policies, that we don't have regulations in place that allow the practice of dental therapy. So in order to bring that here to North Carolina, what we would need to do, folks down at the General Assembly would have to pass some legislation that would amend part of the North Carolina general statutes, and it would grant the North Carolina Dental Board of Examiners power to issue and oversee these professionals, issue licenses and oversee these professionals, and basically create a new designation of dental health professional and lay out what they're allowed to do, and that's the process.
And so that's kind of the legal and regulatory side of it. And then let's say that were to occur and that I decided I want to become a dental therapist. I'd have to probably go to school somewhere.
That's right. So there's this process would take time, so we'd have to pass legislation, we'd have to lay out the guidelines, the regulatory framework, and then educational institutions would have to create a curriculum, and then they get accredited by a the dental association that oversees the education, and once different states have different requirements for how much education, but generally it's around 2 years of education that you can go to, and different levels of degrees. But once we get the educational curriculum in place and it gets accredited and people go through, then we would see the delivery phase, the on-the-ground practice of these professionals begin.
And in your new Spotlight report, which by the way is available at johnlocke.org, and you can just search for the phrase dental therapy and you'll find Jordan Roberts' report right there. You lay out the fact that other states, several of them are now leading the way. Minnesota and Alaska are into this, and it would take time for North Carolina to do this, but if you start the process, then you can do that.
That's right.
It would take time, but there would be definite benefits.
Absolutely.
And you lay this out in the report really well. Talk to us a bit about the kinds of people or maybe the areas of the state that would benefit.
Yeah, so like I said before, if the supervision requirements are set up to allow these professionals, flexible operating ability, they have the ability to go out and, visit rural centers, schools, nursing facilities, so they can really address the dental needs of the populations we talk about in the report are the more rural areas, lower income
so you talk
areas,
about
seniors, and the people that really could benefit from just having more access to preventive and restorative care that they just aren't getting served right now. And so what we've seen in Alaska, where this profession really got started, was the American Indian population. They are the primary recipients of the benefits of this profession in Alaska, and the benefits have been well documented and tremendous: increased access, lower wait times, better overall health outcomes. And then in Minnesota, what the studies have found is that at observed clinics in this one study, they treated 6,000 new patients, and 84% of them had public insurance, meaning Medicare, Medicaid. And so for North Carolina, with 2 million Medicaid recipients, and just half of Medicaid recipients who are under 21 received some form of dental visit in 2017, they could really benefit from increasing the number of practitioners that serve these populations.
That's an interesting point that you make in the report about the Medicaid population. We have, several million people in North Carolina.
Just over 2 million.
Who receive their health insurance through the publicly funded program, Medicaid. And yet, while they do have a dental benefit, there's a huge percentage of those people on Medicaid who never do see a dentist for all sorts of reasons that you go through in the report. But perhaps if there were practitioners that could, dental therapists who could go to them, or simply increase the supply of the number of people who are able to provide this type of necessary work, more people could actually benefit.
Absolutely. And, what we find is North Carolina's the amount of dentists in North Carolina that participate in Medicaid was far below the national average. And so when dentist's office can bring on these lower cost personnel to increase the volume, then they may see a newfound benefit in treating Medicaid patients when there's the demand for that in their area. So like you said, just increasing the supply, here's the goal, and letting the market forces work, and bringing the benefits to these populations.
What I love about this idea, Jordan, is that it seems like it is a no-brainer, so to speak, that folks, no matter your ideology, whether it's left, center, or right, you should be able to agree, one would think, that allowing this to come into North Carolina, making the statutory changes, getting the education in place, that this would really help folks. It would be a big benefit to so many people in our state. Absolutely.
And, we hope we're proud to be a part of this conversation, starting to bring it to the attention of folks, that there's a new profession that, a simple licensure agreement or change in the law could, bring these folks to North Carolina. We hope to see this be passed as soon as possible.